want it.
Fair enough.
Yeah.
Okay, here, let me just put this on so we can see who we're talking to. So
Mm.
this was actually just an impromptu. Lucky enough to have Boo here to talk a little bit about his medicine pathway in the UK. So thank you so much, Boo. I know you're pretty busy, but thanks for giving me a little bit of time here. I don't know
No
that we
worries.
gave you a lot of options, but thank
It's
you.
okay. Yeah, no worries.
I'm just wondering if you could tell us a little bit about what was your pathway from Eunice to where you are right now.
Yeah. So in UNIS, I did biochem and psychology high level. And that's one of the requirement to go to medicine here in the UK is that you need to have both bio and chemistry HL, usually around a 6 or 7. Depends on what uni you go to. But I basically applied to go to Sheffield. Um, my other choices were Leeds, uh, Oxford, and UCL in London. Um, so for medicine UK, you need to do kind of entrance test called either the UK CAT or BMAT. It depends on which university you go to. They require different things. Um, and then the thing about going to the UK is that uni with BMAT requirement, we have quite a big disadvantage just because in UNIS, you only do 2 out of 3 sciences, so biochemistry or physics, but in BMAT, you require all 3, so I found that very challenging, so I had a bit more luck with UK CAT, and Sheffield accepted UK CAT. Then I did 5 years of medical school, and then, I applied to become one of the doctors here in Manchester. So that's my path really.
And you made 5 years of medical school sound like it was a piece of cake. Is that the case, or what does that look like?
Um, I don't think it was particularly challenging. I think, uh it's quite hard to fail, if you know what I'm saying. I think if you just put in time and work, I think you will get through med school. Most requirements here are either pass or fail, and I find that you have to actively try to fail to go through med school. Of course, if you have extenuating circumstances, then yeah, you can fail a year, but the progress you kind of keep going. And I think that if you do biology and chemistry and things like that, I don't think you have bad time just doing the first few years because it's quite focused on the human body anyways. It's until third year onwards that you go into hospital and things, and they will teach you and walk you through that so you don't have to worry about those things.
So you've been in a hospital then for the last 2 years, like as part of
I,
your learning?
so technically for Sheffield, we go into hospital, we do clinical attachments throughout the 5 years, you it kind of develops you into from a medical student to become a doctor. So it preps you to go into hospital as a doctor. So I've only been a actual doctor for about 8 months, but I have clinical experience from first year of uni onwards.
And do you do a clinical experience in all sorts of different disciplines, or what does that
Yeah.
look like?
So it depends on your uni, but they usually try to place you in one of the specialty, and you kind of rotate around in each unit. For example, if you have a cardiology unit, then they will try to place you in cardiology. If you have a, uh GI unit, then they'll place you in a GI specialty. So you kind of learn, you kind of do lectures, but as well you go into clinical placements. You kind of do examinations and practice things that you would do day to day as a doctor.
And so then you become a doctor, and what's the next step then? Like, are you now just a fully practicing doctor, or are there more training?
So in the UK, after I finished medical school, I applied for a 2-year posting, and for the first year, I'm known as a doctor with a provisional license. It's kind of like a provisional driving license. You are still a doctor, but there are certain things that you can't do. For example, I can't really discharge patients on my own. I need a senior member to have a look at what I'm doing and then act accordingly. But after the first year, I'm basically a full-fledged doctor. um, then afterwards, it really depends on what your heart lies basically. So you after the 2 years, you can go into different specialty. You can be a hospital doctor, you can do a general practitioner where you work in the community. So it depends on what path you want to go to, but I choose general practitioner.
Okay, and can you tell us a little bit about where you're working now?
So I'm working in in a district hospital called Macclesfield Hospital, and it's in Manchester. So it is a smaller hospital than you would say a Manchester Royal Infirmary, where it's a city kind of where all the important case go to. I kind of prefer to work in a smaller hospital because there's a smaller cohort of junior doctors, so you get more development in terms of skills. You have more senior support. So, for example, in my hospital, there's only 17 junior doctors, so we get looked after quite well. There's a lot of learning opportunities, but whereas if you go into somewhere like a city hospital, then there's like 100 junior doctors. So in reality, you're just a number, I find, and people don't really know you well. You have to compete for experiences, whereas for me, I don't have that problem. There are disadvantages, of course. For example, in city hospitals, you get more interesting cases. You know, like that's where all the important cases go to. But for me, I don't get to see those things. I have to refer it to the city hospital. So it's a give and take. But I value more my development in terms of a doctor rather than seeing interesting cases at the moment, because I know that if I have a good foundation as a doctor here, I'll see interesting cases later on, so I'm not really too fussed about that.
Yeah, it sounds like you've really thought that all out in terms of what's
Mm,
the best for like your personality and your skill set and what you want to learn.
yeah, um, and I think that's the thing. I feel like, in high school, I mean, it's very limited, but I find the decision to basically pick your higher and lower levels really early on kind of, it really locks you onto a certain field, you know? Like, for example, if I didn't choose bio and chem, I would not have gone into medicine, you know? And it's a big decision for a 16-year-old to make. And I do think that there needs to be some sort of development where you kind of get people to come in and talk to students around that age, you know? I think because for me at least, like, at least I know that I'm happy with the decision I made, but I know a lot of friends who don't have a path when they were 16, so they just choose whatever. They do some sort of generalized degree, and they don't really find a job that they truly enjoy, and I find that really sad and kind of, I just feel like there needs to be some sort of teaching about this.
And what kind of teaching would you have wanted, do you think?
I think, um I know that here in the UK, right, there are certain kind of career development days where they kind of invite people from different jobs to come around, and they set up a stall, and these high school students kind of come around, they ask about, "Oh, what's your job like? How is it?" And I think that I would find that very helpful, you know? Because I mean, not for me, because I know from the get-go that I want to be a doctor, you know? I have quite a big drive in kind of human body, taking care of people, but some people, they don't know that until they kind of meet someone that really inspire them, and I find that very valuable if we can organize something like that. I mean, sometimes even when I return to Vietnam, you know, I feel like I can also talk to someone who wants to do medicine, especially in the UK, because I guess in UNIS, it was quite US heavy. You know, I remember when I was in UNIS and I asked my career advisor about going to the UK, and she didn't really know a lot, you know. It's, and I can't really blame her because most of our students go to the US anyways, and they do SATs and things, but for me, I kind of had to figure all this out by myself. Um, so I think it would be very helpful.
But perhaps you trailblaze because right now I think most of the medicine related students are going to the UK. So it definitely does see our biggest group.
Yeah.
I'm actually working with all those students in grade 10 and 11 who are interested
Mm,
in medicine. So we
mm.
might come and pick your brain, or if you're ever in town, it'd be awesome to have you like come into
Y
school.
yeah, I feel like I won't be coming back, for the next 8 months, but, you know, if you want to, I'm happy to kind of set up a call like this where I talk to them, um, about what it's like to be a doctor and what's the pathway from high school to uni.
Awesome. Thank you. I will actually be showing them this video as well. So at
Yeah,
least they'll
definitely.
kind of have
Yeah,
that to start with as well. But
yeah.
I will definitely be at Eunice. So if you are back in town and want to set something up, that would be really awesome.
Yeah.
One last question. So, if
Okay.
you were your grade 10 self and you could
Mm.
tell yourself one piece of advice, like what would you tell your grade 10 self?
Mm, I think if I were a grade 10 self, right, and I don't know what to do with my life going forward, I think I would try to talk to a lot of people who are in jobs that I like. I think you need to, as when you're grade 10, you need to kind of figure out what your strengths are as a person, whether you're scientific minded, whether you're artistic, and you kind of think about what jobs or what uni degree that you would like to do in the future. I think that would be very helpful. The second thing is that make sure that you have the past papers, okay? That's very important for you, for IB. If you have the past papers and you do all the past papers, you'll be fine. You get good grades, you get into your uni. And I know that me as a doctor now, I already have a job, but in reality, your grades don't matter that much, Like, I know that it's very stressful to get that 6 or 7 for whatever, but it's in the real world, it doesn't really matter that much, you know? It really doesn't. No one cares. No
Nobody
one
cares,
cares.
but you had to get it for that first
Yeah, yeah,
step
exactly,
in.
exactly. So, as long as you get into a good uni and doing something that you like, I think you're successful as a high school student.
Hmm.
Yeah.
Well, thank you so much. I'm sorry for having put you on the spot, but I'm so grateful for you taking this time.
No worries, Mrs. Fairburn. But yeah, if you ever need something, I mean, I would love to talk to kind of